Hi there, this is Hisham Shalaby. I'm a foot and ankle consultant in Edinburgh. This video is about total ankle replacement, including what the operation involves and information about the post-operative period. Ankle replacement is indicated for symptomatic patients with advanced arthritis of the ankle joint who failed conservative treatment. This video is meant for patients who undergo primary total ankle replacement. It does not apply to patients having revision surgery or those having other concomitant procedures. Please be careful that each case is different. This information is generic. You must listen to your own surgeon's instructions. If you are unsure about any aspects of your treatment, you should consult your treating surgeon. This video is in no way a replacement for seeking medical advice when needed. The operation involves a one-night stay at the hospital, but you need to be prepared to stay 2 nights. The operation is done under a general anesthetic and nerve blocks to numb the leg and reduce the post-operative pain. The operation is done through an incision at the front of the ankle joint. The operation itself involves removing bone from the front of the ankle joint and performing specific cuts in the bones guided by an X-ray machine. Using specific instruments, the bones are shaped to accommodate the actual ankle joint prosthesis. The final joint is composed of 2 metal components with a plastic insert in between to allow movement to happen. At the end of the operation, the leg will be placed in a shell of plaster. In the post-operative period, it is very important to keep the leg elevated to prevent excessive swelling. You should be drinking plenty of fluids and doing regular respiratory exercises. You will be given painkillers to take regularly in the first couple of weeks. The paracetamol can be continued for longer periods if needed. The other strong painkillers are better stopped within 1 to 2 weeks if the pain is under control. You will have a follow-up in 2 weeks to have the sutures removed. The plaster will be discarded and the boot will be applied, and you will be referred to physiotherapy. Your next follow-up appointment is at 6 weeks, where the boot is discarded and X-rays are obtained. You will have further follow-up appointments at 12 weeks and 6 months for X-rays and clinical checks. In the first couple of weeks, you shouldn't be putting any weight through the leg, and you will be using auxiliary crutches to mobilize non-weight bearing. When you receive the boot at the 2 weeks post-operative mark, you can start putting some weight and build this up gradually. At the 6 weeks post-operative mark, the boot can be gradually weaned off and you can start putting more weight on the leg. This should be guided by physiotherapy. Physio usually starts between weeks 2 and 4 with core muscle strengthening and gait training. At 6 weeks, physio should involve further exercises to regain range of movement and can also perform calf stretching exercises and strengthening exercises to the tendons around the ankle joint. You can start using your normal shoes at the 6 weeks post-operative mark. These should be supportive shoes as much as possible and should accommodate possible swelling. Ideally, the shoes should be lightweight and should have a wide base to offer stability. If you are instructed to have insoles in your shoes, the shoes should have enough room to accommodate those as well. If you are working, the return to work will depend on the nature of your job. If you are performing desk-based duties and you do not need to drive to work, you might be able to go back as early as 4 weeks. Whereas for more physically demanding jobs, you might need as much as 6 months before you are able to perform your job properly. It is, however, not advised to go back to high-impact duties following a total ankle replacement. You can consider going back to driving after 6 weeks. You should only drive if you feel that you are confident enough. This is very variable from one patient to another. You must be confident that you are able to do an emergency stop, and you should inform your insurance company. If you plan to fly, you better do that after 12 weeks. If you have to fly during the first 12 weeks, you are advised to ask for airport assistance. The usual instructions for flying after lower limb surgery includes wearing compression stockings, drinking plenty of water, and avoiding much alcohol. You can take a course of aspirin around the travel dates if you are allowed by your GP and if you are not already on blood thinning medication. Regarding sports, you can go back to walking short distances from the 6 weeks mark. You can also start swimming around the same time. Following that, you can introduce small increments of static cycling and build those gradually. If you golf, you can consider a couple of holes at the 12 weeks mark and again build up from there. You can consider the more aggressive sporting activities like hiking from the 6 months post-operative mark. The risks following ankle replacement include wound healing problems, sensitive scarring, infection, nerve injury, ongoing pain, joint stiffness, and blood clots. The current survivorship of total ankle replacement is around 90% at 10 years. If you are suffering from ongoing pain in your ankle that is limiting your daily activities, you need to be examined and investigated by a specialist. Thank you for watching.